Hi, Bob Quinn for Blue Poppy here. Just wanted to briefly review some Teishin techniques for the abdomen and then for other points as well. This is the simplest tonifying technique for the abdomen I've ever learned. I could do it seated, or I could do it standing. If I'm standing, I want to make sure that my spacing to the patient is the ideal. If I come here, of course I can do it, but the angle feels not so great, not so engaged. I come here and it feels much more engaged. So this is an important piece. Now, I want to have enough of the Teishin exposed so that it's easy for me when it comes down to cover. If I'm here all choked up on it, like someone looking for hitting singles instead of home runs, it's too tight to be comfortable. That'd be like Pete Rose and Ichiro. If I'm all the way back here, it's unwieldy. I want the exact amount that allows me easy access. So very flat angle. As the tool comes down and touches, that's when I cover. Remember, covering the point of interface makes this a tonifying technique. I'm starting here, epigastric area. I'm going to wander, end up down here at the ASIS closest to me, and then I'll leave a hand there. I'll come up, I'll do it again, and do it again 3 times. Now, I've already checked a few points for tension. I've got points in the arms, neck, and in the leg that are tense. My contention is doing this technique, I'm going to get some change there. Not 100% change. That will demonstrate that treating the abdomen is very important. About 10 or 12 points of contact. That's one pass. Two. The skin itself is changing now. Feels younger, more spirit, more shen to the skin. I'm going to put my Teishin down for a moment and check. The liver 7 had been so ropey tight. I'm pressing tighter or more firmly now than I was before. Of course there's tone there, but it's just gone. Here I have better change on this side than this side. You'll see it's not uniform. But even over here, it's probably 20 or 30% less tight. Over here, it's more like 80%. We come up here, you feel just so much less tight, probably 50%. On this side, it wasn't as tight to begin with, but also got good change. So that demonstrates the importance of treating the hara. For the sake of the camera, I'm going to still stay in the hara, but this technique that I'll show now, the listen and follow, this could be done anywhere. Say I'm palpating up the legs and I notice stomach 36 on the right is very tight relative or compared to the left. That would be enough to treat it with this technique. We treat generally the tight side. So I'll try to find something in the abdomen that's a little bit too tight. And this can be done as a one-hand or a two-hand technique. So what I want to, I'm going to take this hand away just for the purpose of the camera, then I'll bring it back. I want to show that when we're on the point, it's not the kind of chi paradigm work where we're just barely touching. We actually are engaging the tissue. Can you see this downward press down to the level of the superficial fascial layer. Once we get to that layer, we listen. But when we say listen, we're saying feel listen. We're making a new sense. We're combining feeling with paying attention as if we were listening. Okay, and so there's a point. A one-handed technique would look like this. A two-handed technique would look like this. Either way possible. I'll start. Now, as I'm going to be descending now, I engage my spatial awareness. I descend. I already can feel that I'm at the right level. And I'm going to follow the path of ease in this layer, and it's heading in this direction. But that will change. It changes almost immediately, starts hooking back around. Now it's going to a slightly deeper level, heading this way. Still heading in that direction. When I say heading in that direction, the Teishin is on the same point that it started. There is some movement, but it's not from the Teishin moving over the surface of the skin. Now it's this direction. Now I've hit a roadblock. Now I'm going to vibrate. I'll use both hands. And immediately it opens up to go in this direction. Again, I'm not, I'm just following. I don't try to make it head in any direction. We say it's like a drop of water going down the pane of glass. Still in this direction. And there'll be a time when it feels like the line has played out. I'm at another roadblock, and we'll say that's enough actually on that line. So again, we were going down. We find a level that needs to be worked. It's the superficial fascial layer generally. And we start, it'll feel like you're following it like this. If you watch the path of a river from up in an airplane, you see it's never just perfectly straight. It meanders. It's like that with this technique. So we reviewed this tonifying one from the abdomen. We've demonstrated it gets effects at distal areas. And then we can check, did anything from working one point change? No additional change. Some additional change. And some additional change, right? But in general, this I think is the great contribution of the Japanese way of acupuncture, is this appreciation for how important the hara is. Thank you.